Well, welcome everyone. My name is Matt Price. We have a special guest with us today, Jo Middleton, and really glad, thankful that each of you are able to join us. Looks like we have a couple dozen clients on the line, and then a handful of people who are friends that are joining us as well. My name is Matt, like I said, picture of Randy. Randy's playing a little bit of hooky. My triplet siblings, his three youngest children, just finished their junior year of college, and they snuck down to the beach for a few days before they start summer jobs, internships, all of that. So he said to say hello on there, but we're family owned and operated firm, 45 plus years of experience. Big thing that we do is we're a fiduciary. So we always put the client's best interest first, which we think is really important. And what we've done over the past number of years is we've created a retirement niche. A little over 90% of our clients are retired. The other 10% are closing in on a retirement pretty quickly. So that's all we do Monday through Friday. We've been really honored and humbled to receive a number of awards from Barron's, Forbes, Financial Times. Many of you probably are receiving our weekly email where we put out our Wealth Coach podcast, a quick 2 or 3 minute video. We both attended, Randy and I both attended the University of Wharton to get our CIMA designation. We're both certified financial planners. We think credentials really matter. But I have a team of 5 here, as all clients know, and it's been a real privilege to work with Randy for the last 10 plus years and get to know everyone. But without further ado, Jo Middleton, she told us just a few minutes ago this picture's old, but she's aged really well, if I may say so myself. And she's worked with quite a few clients for us and helped us kind of get into the granular details of Medicare. And she's a wealth of knowledge. Any questions you might have, you can email me, matt.price@stewardpartners.com. I'll be looking at those, the email while she's speaking. And without further ado, Jo, we'll let you take over.
Great. Well, thank you so much, Matt, for inviting me to be here to speak with everybody today. I always love to do these Medicare 101s, as I call them, and it's always a privilege to work with your company. You guys do such a great job for your clients, and I'm always delighted when one of your clients calls and asks us to become their advisors for Medicare. So I'm going to go ahead and see if this works and share my screen now. So let's see if this works. All right, did that work? Hopefully you guys can see the Medicare 101 on my screen now. So basically then, this presentation was put together specifically for the Price Group today. And my job is to give you a little bit of an understanding about this alphabet soup known as Medicare, A, B, C's, and D's, and what all of your different options are. I know that many of you will probably have questions, and I will, the very last slide will ask you what those questions are. So if I can ask, if you have a question, to jot it down as I go through the slides, and then when I get to the end, I'll go back and answer specific questions. And that's because probably I'll answer your question before we even get done with the slides, okay? So here we go. So here's our agenda for today. We're going to talk about Medicare basics. What is original Medicare? When can you enroll in original Medicare? What your coverage options are, original Medicare, Medicare Advantage, what the heck is the difference between those? And then we'll talk a little bit about coordination of benefits. Lots of people these days are working past 65, and that can really make a difference as to what you need to enroll and when you need to enroll it. So I'm going to address a little bit about that as well. So what is Medicare and who's eligible? Well, Medicare is basically an insurance program set up by the government for people that are 65 or older, or people with certain disabilities. It has nothing to do with your income as to whether or not you're eligible for Medicare, although your income has a bearing on how much you have to pay for it. And it's important that you do have to be a US citizen or a legal resident that has lived here for at least 5 years in a continuous row. The original Medicare is run by the government, not by private insurance companies, but you can privatize it in the form of a Medicare Advantage plan, which again, I will address. Medicare covers medical services for a beneficiary. It began back in 1965 under President Johnson, his Great Society. And we actually didn't get drug coverage, which is known as Part D, until the implementation of the Medicare Prescription Drug and Modernization Act of 2003. So the first President Bush passed that bill in 2003, and finally in 2006 is when Part D drug coverage was born. And then in 1997, that's kind of going back a little bit now, but under President Clinton, we passed a bill into law which was called Medicare Plus Choice. And in 2003, that name was changed from Plus Choice to Medicare Advantage. So that's just a little bit of the history of where we started and where we've ended up. So original Medicare back in 1965 and today only consists of two parts. And I'm going to spend the first part of this presentation telling you just about original Medicare, okay, and when you can enroll in it, and then we'll deal with the other pieces as well. So this is what a Medicare card looks like. In our office, we call it your red, white, and blue card. And so this is just an example of the front and the back of that card. So Part A under Medicare is known as your hospital insurance. And hospital insurance covers these major things that you're looking at on the sheet. But I always like to tell people the easy way to remember what does Medicare Part A cover is just to remember SH. And SH stands for skilled nursing facility stays. It covers hospital stays, and it also covers hospice care. Okay, those are the three main things covered under Medicare Part A. So remember SH, and you'll remember what's covered under Medicare Part A. And Medicare Part B, this is the part of Medicare that we use the most. Medicare calls this your medical insurance. The easy way to remember what does this cover, so you don't have to remember this whole list, is just to remember DOD. Now, in some parts of the government, that means Department of Defense, but that's not what we're talking about, obviously, with Medicare. DOD stands for doctors, outpatient, and durable medical equipment. Okay, so your doctors in the hospital and out of the hospital are covered under Medicare Part B. Anything that you do on an outpatient basis, whether that is lab tests, x-rays, MRIs, physical therapy, any kind of outpatient surgery, that's all outpatient. And then durable medical equipment is going to be things like wheelchairs, walkers, oxygen. You know, if you break your leg and they give you one of those lovely little scooter things to hop around in, that would be durable medical equipment. So that's what's covered under Part B. And so how much does Medicare really cost? Well, Part A, which is the hospital, and you'll notice I've got 2021 in here, and this is important. These numbers change every single year. And this is one of the reasons that whenever I do this and people say, can we have a copy of your presentation? I always have to say no, because these numbers change. And because of CMS guidelines, you always have to make sure that you're looking at the right information. But in 2021, Part A is zero premium. There is no cost for most people. And that's as long as you have worked at least 10 years and paid your Medicare and FICA taxes, okay? But when you activate Part A and you use Part A, there are some out-of-pocket costs that you are responsible for at the time of service, if all you have is the lovely little red, white, and blue card. So in 2021, the deductible for Part A is $1,484. And this deductible is a benefit period deductible. That's right, benefit period, not calendar year. And a benefit period for being in the hospital is only 60 days. So what that means is if you have multiple hospital stays in a calendar year with at least 60 days in between, you can incite this deductible multiple times. If you happen to be in the hospital more than 60 days, instead of paying a new deductible, now they're going to charge you a co-payment, which they sometimes refer to as co-insurance by the day. And it's $371 per day this year for days 61 through 90. And if you happen to be in the hospital more than 90 days, unlikely, but it could happen, now you're going to start eating into your lifetime reserve days. Medicare gives you 60 of them, maximum for your entire lifetime. And this year, for the privilege of using them, your cost would be $742 per day. Okay, and there's no out-of-pocket maximum that you would be responsible for. I mean, every time you incite these things, you are going to pay these dollar amounts. So then we have Medicare Part B. And as I mentioned, this is the part we use the most. This is considered your medical insurance. The standard premium for Medicare Part B this year is $148.50, and this is per person per month. If you get a Social Security check, the Social Security office, you know, they are the government, they reach into that Social Security check and they pull out that money before you ever get the check. But if you're not getting a Social Security check, this monthly amount will be billed to you on a quarterly basis. And this is the premium that is based on income. And I'll show you that on the next slide. So once we've paid for it, what do we get for Part B? So first and foremost, Part B has its own deductible. And this one is a calendar year deductible. This year, the Part B deductible is $203. That's about 2.5 doctor's visits, okay, that you are on the hook for paying. And then once you have met this $203 deductible, now you will be responsible for 20% of the rest of the bill. And there is no out-of-pocket maximum on this 20%. So no matter how high that bill goes, you always owe 20%. And then we also have something called excess charges, which doesn't come up too frequently, but basically excess charges are going to be for doctors that say, we do not accept assignment. And if they use that word assignment, what they're telling you is that we do accept Medicare, but we are not going to accept full payment from Medicare, and we're going to balance bill you. And that's what these excess charges are, okay? And you are responsible for those excess charges if all you have is original Medicare. So this is that chart, and I appreciate this is probably not that easy for you to see. I've tried to make these numbers a little bit bigger, but I do have this on a chart, so I can certainly share this with Matt if we need to send this out to you. But in order to pay the standard premium for Medicare Part B in 2021, the federal government is going to go look at your 2019 tax return. And as an individual filer, if you were a standard income filer, that means your modified adjusted, where did that go? Modified adjusted gross income was $88,000 or less, you're going to pay the standard premium. As a joint filer, to be a standard payer, you have to have a joint income, modified adjusted gross, of $176,000 or less. But you'll see there are 6 income brackets. And so your Medicare Part B premium can be anything from $148.50 all the way up to $504.90. And if I have to tell you, this is one of the things that I find is the biggest surprise to people that they don't plan for in their retirement is how much is this Medicare Part B going to cost? Because if you are in a higher income tax bracket, you know, what you're going to pay to the government can be sometimes in some instances more than you were paying for your employer plan. So when can you first enroll in Medicare? So there's lots of different enrollment periods for Medicare, but the first one that we deal with most frequently is called your initial enrollment period. And this is when you first become eligible, and it's based generally on your 65th birthday. Then there's an enrollment period called the general enrollment period, and this is for people that didn't enroll when they first became eligible, not because they had other coverage, but because they just missed it. And so this is called the general enrollment period. And then we have what's called a special enrollment period. And this is for people that didn't enroll when they turned 65. And probably they didn't enroll because they were still working. Maybe they were on their employer plan, and they will have a special enrollment period to enroll when they retire from that employer, okay? So let's talk about the most common, the Medicare initial enrollment period. This spans a 7-month window. It begins 3 months before the month of your birthday. You've got the month of your birthday, and then 3 months after the month of your birthday. So in our example, if you were born in June, then your 3 months before starts in February, okay? Actually, if you start on June the 1st, yeah, it would begin on February the 1st rather than March the 1st. And then it's going to end 3 months after the month of your birthday. So June, that would be July, August, September. Medicare coverage always begins on the 1st of the month. So I don't care if your birthday is on the 2nd or the 31st, your birth month, if you enroll before the month you turn 65, your Medicare will start on the 1st of that month. And the only difference from that is going to be if your birthday happens to fall on the 1st. If your birthday falls on the 1st, they'll actually award you your Medicare the month before your birthday, okay? So that's important to know. If you were already collecting a Social Security check, so you started collecting maybe at 62, you will be auto-enrolled into Medicare. Okay, you can't get Medicare at 62, you have to wait till 65, but you would be auto-enrolled. But if you are not getting a Social Security check, you will not be auto-enrolled into any part of Medicare. You have to take action if you want to enroll. Okay, and your Medicare enrollment is based on you turning 65. It doesn't matter if your spouse is, older, younger. Just because your spouse turns 65, that doesn't mean that you also become eligible for Medicare. Okay. Oh, I am so sorry. Okay, so during this initial enrollment period, what can you do? So you can enroll in Medicare Part A and Part B, or both. Sometimes you don't need to enroll in both, just depends on how you're currently covered. You can choose how you want to receive your coverage. Do you want original Medicare at this point, which you still have to enroll in it, even if you decide you want a Medicare Advantage plan? So you can decide, do I want a Medicare Advantage plan, or do I want some other kind of coverage? You can enroll in Part D prescription drug coverage, and I'm going to talk about both of those in a minute. And you can enroll in what's called a Medicare supplement, but you don't do that with the government. You do that with a private insurance company. So the other important period to know about when you are in Medicare, this only affects you once you have activated your Medicare, and this is what is called the annual election period. This is a bit like open enrollment at work, okay, when you have the opportunity to change your Medicare benefits. And so this annual election period is October 15th through December the 7th, and it affects Medicare Advantage plans and Part D prescription drug plans, okay? If what you're doing is working okay and you don't want to make any changes, then generally speaking, you don't have to do anything. You'll be auto-enrolled and continue on the plans you're on. But it is always a good idea to review your coverage because the plans do change from one year to the next. And of course, your health can change as well. So always important to make sure you have the best coverage for you. So a special enrollment period happens when you have a life change. So there's lots of these, but the most common one is going to be someone that turned 65, continued to work past 65, perhaps didn't enroll in Medicare at all, or maybe just enrolled in Medicare Part A, and now they are planning to retire. They have a special enrollment period to now enroll in Medicare without a penalty. And this is the important thing. You do not have a penalty for not enrolling in Medicare at 65, as long as you can prove that you have credible coverage, like through an employer, for example. So special enrollment period, let's talk about this employer special enrollment period. So let's just say you're 67 and you did continue to work for your employer, and now you have an 8-month window to enroll in Medicare without a penalty. Now, most people do not take 8 months to do this, right? Because nobody wants to be without coverage, but everybody wants to have their coverage for their Medicare start on the day after, the first of the month after their employer plan coverage ends. But the important thing to remember here, and I'm going to address this a little bit later, is that you have an 8-month window from the time the coverage ended as an active employee. So in other words, please do not think that at 65 plus, you can retire and take Cobra for 18 months and then enroll in Medicare. You cannot. If you do that, you're going to have a penalty for late entry into Medicare. And the other important thing is Cobra pays secondary to Medicare. So you are opening yourself up for a whole heap of problems and bills if you think that you're going to take Cobra after 65. And then, so that was an 8-month window to do that. But then you have to have drug coverage. If you don't enroll in drug coverage and you can't prove you have credible coverage, there's a penalty involved in that too. But you only have 2 months to enroll in prescription drug coverage after your active employment ends. So again, most people don't wait 2 months. They contact my office or whoever's going to advise them about Medicare, and they enroll so that their new coverage starts immediately after their old coverage ends. So you can see on the bottom here, Cobra and retiree plans are not considered employer health plans for the purposes of Medicare. So you're not eligible at the end of this coverage. You have got to make sure that you enroll in Medicare A and B, if you've not done it, within 8 months of losing your employer coverage as an active employee. And Part D, you need to do that within 2 months. So what happens if you miss these periods? What if you didn't enroll at 65 and then you missed your special election? Well, it can be pretty costly. So it is important that you have to know the consequences of your choices, okay? It's important that you do enroll on a timely basis. So let's talk about what they are. Penalty for a Part A late enrollment. As long as you get premium-free Medicare Part A, you have no penalty for being late. The only time you have a penalty is if you have to pay a premium for Medicare Part A. And the only people I come across that have to do that are going to be usually foreign nationals that have come into the country, people that just have not worked enough quarters and haven't had a spouse that worked enough quarters so that they can piggyback off of them. So I don't deal with too many people that have to pay for Part A, but that would be the only time you'd have a penalty is if you had to pay for it and you didn't enroll in time. The Part B penalty, this can be quite costly, but again, the penalty only exists if you didn't enroll at 65 and you cannot prove that you had credible coverage as the reason that you didn't enroll at 65. So in other words, you were on an employer plan and you can prove it, then you would be fine. But a penalty, the way the penalty works for Part B is it's 10% for every 12-month period that you delay. So delay it 24 months, 20% penalty, okay? Delay it for 3 years, 3 years, now you've got a 30% penalty, and it just keeps going up and getting worse. And this penalty is not a once and done, it's every month for the rest of your life. And then Part D, which we haven't talked about yet, but there is the late enrollment penalty for Part D. This typically comes up a lot when people come onto Medicare and they say, well, I'm not taking any drugs, so why do I want to enroll in a drug plan if I don't need it? And the reason you want to enroll in a drug plan, even if you're not taking drugs, is because the government says, do what we tell you to do when we tell you to do it. Otherwise, there's a stick that we're going to beat you with afterwards, and that stick is the form of a penalty. The penalty is quite low. It's 1% of the average cost of a prescription drug plan per month. And that average cost varies from 1 year to the next. In 2021, the average cost is a little bit more than $33 a month. So the penalty is 33 cents a month currently this year. But they tally up all of those 33 cents a month that you were late, and then they hit you with the penalty. And again, this penalty is every month for the rest of your life. So once you have enrolled in A and B, Original Medicare, then you get to play on this lovely little hopscotch chart, and you get to decide, how do I want to receive my Medicare benefits? Option number 1 is going to be you'll use your Original Medicare as your primary insurance. You'll invest in a Part D prescription drug plan to make sure there's no penalty for Part D. And then most people choose to buy a Medicare supplement, also known under the term Medigap plan. If you're talking to the government, that's what they call them, to help pay some of those out-of-pocket costs under Original Medicare. And I'm going to talk about Part D and supplement plans next. And then the second option, which we'll also talk briefly about, is Medicare Advantage. These are, in the industry, we know them as Medicare Advantage, but the government likes to call them Part C because, of course, everything's a big alphabet soup for them. And so this is what happened to Part C. And I'm going to talk about that as well. So let's talk about Part D, prescription drug coverage. Again, it began back in 2006. And this is the coverage that is going to help pay for the cost of your prescriptions. There is a blueprint for how these plans must work, and the blueprint is designed by the government. All of the plans have to have a catastrophic phase that protects you from some of the high costs of drugs, although drugs can still be very expensive under Medicare. The plans can change from 1 year to the next. Every plan has a list of drugs that they cover. That list is called a formulary. And the plans are allowed to have a deductible on the front end before they give you any cost sharing. Now, these plans, while designed, the blueprint of the plans were designed by the government, they are administered by private insurance companies that hold a contract with the government, and they are calendar year plans. So basically, your plan is a January through December. No matter if you join in July or August, the plan changes again the following January. And you have the opportunity each year during the annual election period to change the plan. And like as it says here, the plan can change from one year to the next. So don't assume that your plan, is not going to change, and that's why you want to review it. So understanding Part D. So this coverage is probably the most complicated part of Medicare. There are stages to the coverage, and they have a stage here called a donut hole. Now, I'm actually quite partial to Shipley's Donut Holes. It's my favorite donut shop in Houston. And they're sweet and yummy, but these donut holes are not so sweet and yummy. They're actually quite ugly and disgusting. So let's talk a little bit about how this works. So basically, 4 stages to the coverage. You start out with a deductible, and this means you have to pay the full amount for your drugs until the deductible is met. And then you move into the initial coverage phase. And in this initial coverage phase, this is usually where you have copays or a percentage that you are responsible for the cost of your prescriptions. So maybe a tier 1 drug might be a $5 copay, a tier 2 drug might be a $10 copay, etc. And you're going to do that until the full cost of your drugs, not what you have paid, but the full cost of the drugs has reached a certain threshold. And this year, that's $4,130. Once you meet that threshold, once the full cost of your drugs reach there, that's when you hit the coverage gap or the donut hole. And this feels like the Wicked Witch of the West flew over your home and waved her magic wand, because all of your copays and co-insurance is going to fly out the window. And now you get to pay 25% of the cost of all of your drugs. And you're going to do that until you've spent $6,550 out of your own pocket. And that's when you'll move into the catastrophic phase of the coverage, where you get to pay a copay again for your drugs, or 5% of the cost, whichever is the greater of the two. And all Part D drug plans and coverages work exactly the same way. The numbers to get into the donut hole and get out of the donut hole are exactly the same on every plan. What's different about the plans is the formulary, the list of drugs that they cover, and how much they charge you for the plan. So Medicare supplement plans, or Medigaps as the government calls them, these are plans that are designed to be a secondary payer after Medicare and to help cover your co-insurance and your co-payments and your deductibles. They're again administered by private insurance companies, and insurance brokers like myself sell these plans. I also sell the Part D drug plans as well. But the plans themselves were designed by the government, and somebody up in Congress, in their wisdom, decided to alphabetize these plans as well and start back at A. So you can see this is why Medicare is so confusing, because there's a lot of letters and there's a lot of duplication of letters as well. The benefits vary by plan, but generally speaking, the more comprehensive the coverage, the more expensive the plan is going to be. Medicare supplement plans are not governed by the annual election period for Medicare, which was October 15 through December 7th. Medicare supplement plans can be changed at any time of the year at all, but you only have one open enrollment period to join a plan. And that open enrollment period is a 6-month window that becomes effective when your Part B coverage goes into effect. Okay, and during this first 6-month window, what we call open enrollment for Medicare supplements, you cannot be denied coverage from an insurance carrier for that Medicare supplement. It doesn't matter what medical conditions you have. They can't ask you about medical conditions. It is all based on your zip code, your gender, your age, and your tobacco usage. That's what they use to determine the premium. Okay. Once you are outside of your Medicare supplement open enrollment period, however, if you want to buy a supplement or change a supplement, you are subject to medical underwriting. And insurance companies can decide not to take you at all, or to really create a rate up and charge you more money, basically, for certain medical conditions or medication. And then we have Medicare Advantage plans, which they call Part C. And I put here, think Joe Namath. I know you have seen Joe Namath on the TV asking you, are you getting all you deserve or all you can from your Medicare, right? Especially at certain times of the year. I think he's on every other commercial. And this is what Joe Namath is talking about, Medicare Advantage plans. This is how you privatize your Medicare. It combines your Part A, hospital, your Part B, medical, and in most cases, your Part D, prescription drug coverage, all in one handy dandy little plan, much like you had when you were working, okay? These plans are allowed to offer some additional extra benefits. And Jo Namath loves to tell you all about those extra benefits on the TV. But the way these extra benefits work is that the federal government gives the insurance companies a list each year of the different types of extra benefits that they are allowed to offer each Medicare beneficiary. And trust me, no insurance company offers all of the benefits that Jo Namath talks about on the TV. They all pick and choose which of those benefits they want to offer, okay? So in order to be eligible for a Medicare Advantage plan, you must be and stay enrolled in Medicare A and B. So in other words, you're still paying the premium for that Part B, even if you're going to privatize it with a Medicare Advantage plan. You must live in the plan service area. That can be certain counties. It could be the state of Texas. It just kind of depends. Your health and your financial status are not affected. And actually this says that you can't have end-stage renal disease. And actually this is now not the case. As of 2021, they don't even ask about end-stage renal disease either. So those are the different parts of Medicare and the different options that are available to you. And then we have this whole coordination of Medicare benefits. And lots of people, this comes up a lot when people call me and tell me, you know, listen, I am working, I'm becoming eligible for Medicare, and I need to try and figure out, do I come off of my employer plan? Do I stay on my employer plan? You know, do I need to enroll in Medicare while I have an employer plan? So we're going to address some of those scenarios right now. So when you transition into Medicare, when you become eligible for Medicare, it's really important to understand how Medicare will interface with your current insurance. And this will help you determine whether or not you should enroll in Medicare or not. So here are some common scenarios. People turning 65 that are still working and have insurance through their employer. People who have insurance from their former employer, and they have either retiree insurance or Cobra. So you were already on it, now you're turning 65. Or different types of, and different types of insurance work differently. So, you know, oftentimes you do need to talk to your benefit administrator at your work as well. So here are some common things. So if you are 65, currently working, and your employer has less than 20 employees, Medicare would be primary for you, which means that even if you're going to continue to work and you want to stay on your employer plan, you have to enroll in Medicare A and B, because otherwise you could be subject to a penalty later on down the road. And Medicare is your primary insurance. So if you don't have it, you're going to be on the hook for what Medicare would have paid. If, however, you are 65 and older, are still working, and your employer has more than 20 employees, now you can decide if you want to delay entry into Medicare, because if you're going to continue to work and want to stay on your employer plan, that employer plan would be primary, and any Medicare coverage you have, which would be secondary. Okay, so again, 20 is the magic number if you are over 65. If you're someone who is eligible for Medicare under 65 because you have a disability, now the magic number moves up from 20 to 100. So if you're disabled and still working, want to stay on your employer plan, and they have more than 100 employees, the employer plan is primary, don't need to enroll in Medicare. But if you're disabled and you work for an employer with less than 100 employees, Medicare is primary, you need to enroll when you become eligible, okay? And this slide here is taken out of a publication from CMS called Who Pays First? And you can Google that and download it. We use it a lot in our office to answer Medicare questions. So some of you may be working and you may have a health savings account and a high deductible health plan. These plans are designed to help you, health savings accounts are designed to help you save to pay for medical expenses. And I certainly, you know, we offer this at our agency, and I have a health savings account and I have a high deductible health plan. But people that are eligible for Medicare, if they enroll in any part of Medicare, Part A or Part B, they are not eligible currently to continue to contribute to their health savings account. So oftentimes when you call my office and you're asking us to assess what you need to do, these are going to be some of the questions we're going to ask you. How many employees work where you work? Tell us about your current coverage. Do you have a health savings plan? Are you on a high deductible health plan with a health savings account? Because this is really important in knowing what it is that you need to do. So again, if you have a health savings plan and you want to continue to contribute to that health savings plan, you shouldn't enroll in any part of Medicare when you first turn 65. And then we talked briefly a little bit about this earlier, Cobra, but Cobra applies only to large employers. So large employers, if you're over 65, that 20 was that magic number. And Cobra always pays secondary to Medicare. So again, you can imagine if you thought that you could go on Cobra at 65 and not enroll in Medicare, and now all of a sudden you have some big medical procedure come up, that insurance company that's providing the Cobra coverage, which was exactly the same coverage you had as an active employee, is well within their rights to come back and bill you for everything that Medicare would have paid. And I have seen this happen. So that's why I always say Cobra, not a good option if you are over 65, okay? And again, you've only got 8 months from the time you lose active employment coverage to enroll without inciting a penalty for Part B. So here we go. Any questions for any of those things that we've talked about? And I think on time, Matt, I think we're doing okay. Stunned silence. So either I just confused you all royally, and you're just sitting there in a stupor saying, bring me some more coffee, or you're trying to figure out how to unmute yourself so that you can talk to me. I'm not sure which. Well, I'm not hearing any questions, Matt. So, I might suggest then that perhaps if you guys have some questions, you certainly can call my office. I am not in my office today. I'm actually not even in the country today. But my office, my client specialist team would be there to answer questions for you. Or certainly you can email Matt questions and Matt would certainly be, able to send them over to me and my team. I guess I should have put my email address on here, but I'll gladly give it to you. My email is Jo Middleton at TMIA, that's Trademark Insurance Agency, TMIA.biz. And I also often recommend that people can also email client services with an S at TMIA.biz. Yes, we're a .biz, not a .com. Because not only will I get that email, but it'll also go to my client service team as well, who are very knowledgeable and trained to be able to answer questions for you.
Joe, we got a few questions coming in.
Okay.
First one, what is the definition of an employee only W-2? Or do 1099, does that count as well?
So it will depend. An employee, so I'm guessing they're asking this for counting purposes as to how many employees. Generally speaking, an employee is going to be someone who is a W-2. But the other thing would be, how is the employer treating the 1099s? Are the 1099s on the employer's health plan? That could come into play. But generally speaking, employees, as far as size of whether or not we should enroll in Medicare, is based on W-2s, not 1099s.
Okay, thank you. Another question here. Can you please describe how TRICARE for Life fits into Medicare? Are you familiar with TRICARE for Life?
I am familiar with TRICARE for Life. It's not an area that I profess to be an expert on, but with TRICARE for Life, you do need to enroll in with Medicare. I have some people that I have as my gurus, I should say, that help me with TRICARE questions. So I probably need a more specific question about TRICARE, and then I could get you an answer. But it's a bit too complicated in 2 minutes here to kind of really give you a synopsis. We could probably do a whole other presentation all on TRICARE and Medicare. But if it's a
Okay.
specific question, have them email me and I'll happily get the answer.
Perfect. Good information. Do companies contact their employees about Medicare Advantage if retired when they turn 65, or is it up to the individual?
It depends what we mean by companies. Are you meaning the company you work for, or you mean companies as in insurance companies?
Past employers.
Yes, no. Your employer is not going to, you'll be lucky if your employer knows anything about Medicare and knows, anything to be able to advise you about when you should enroll or what you should enroll in. So typically employers do not know anything about Medicare Advantage. Sometimes I do these presentations for employer groups because I work with other brokers that do group business, and they ask me to do these for their employees. But that's the only way really you're going to get it from your employer, is if that employer has asked an expert like me to come and talk to them.
Okay. And I think we went over this briefly, but just kind of Reader's Digest, what is the advantage of the Advantage plan?
So everybody is different. So it really depends. There is no perfect answer between, is there an advantage to doing Medicare Advantage versus Medicare Supplement? There are pros and cons with each. To put it in as tight of a nutshell as I can, with Medicare Supplements, you're going to pay on the front end for your medical care. You can see any doctor anywhere in the US that will accept Medicare. There are no networks, so to speak. You have fixed costs because you're going to pay those premiums every month, and you have very little outlay at the time of service. But there are certain things you're not going to get. You're not going to get dental, you're not going to get vision, you're not going to get any kind of hearing benefit because Medicare doesn't cover those things. Medicare Advantage, on the other hand, is like paying on the back end. Many of them are zero premium, so you don't pay a premium like you do with the Medicare Supplement, but you pay at the time of service. So everything is a copay or a percentage, and it goes against your max out of pocket. It's a bit like going to Ruth's Chris Steakhouse, when you go, oh, I like that 8-ounce filet, and it comes, but it's the only thing sitting on the plate. And so now if you wanted the baked potato and the asparagus and the Caesar salad, you could have had it, but it was all a la carte and you had to pay for it. Same concept with Medicare Advantage. It's a pay as you go. Every time you do a test, you have a blood test, you do something, you're going to pay at the time of service. And lots of these plans have some added extras, like maybe some dental, some vision, a free gym membership. Those are like some of the typical bells and whistles that may be added in. But they're all network based. So doctors and hospitals have to be in network with your Medicare Advantage plan, not just take Medicare. So pros and cons just depends on your philosophy.
And that's kind of a great segue of every person is different from a standpoint. These are great questions. We got a few more here, Jo, if you have a few more minutes. But reaching out to Jo, and she can really talk to the specifics of what might work best for you and your family. But here's a couple more. My wife reaches 65 next year. If she enrolls in Part A, can I still have my HSA because she is 2 years older than me?
So I'm guessing then that based on the question, I'm assuming that the husband is providing the employer coverage. And if that is the case, yes, you can have the HSA, but you can only contribute the individual amount to that HSA, not the family amount if your wife has Part A.
Okay. And the last question I see here, as of right now, I have coverage through a Medicare Advantage plan offered through my former employer's retirement benefits. Right. Several colleagues have advised me to get a separate Plan G, as in green, in addition to the Medicare Advantage. Do I need both?
Okay, you legally cannot have both. So you can come off of that employer retiree Medicare Advantage, and I am seeing that the employers that do offer retiree benefits, more and more of them are moving to Medicare Advantage for cost purposes. So you certainly could come off and have a Plan G, but it would be instead of that retiree benefit, and you would also need to buy a drug plan as well. And you can actually come off of that retiree plan anytime you like. You don't have to do that during the annual election period. That would be a special election for you to buy a supplement if you wanted to do that. The danger here, however, Matt, is that oftentimes with these retiree benefits, once you walk away, you can't go back. Not 100% of the time, but 99.9% of the time. So it is important that before you make that choice, you realize that you might be giving up something that you can't go back to. And lots of people do when they think that it's better, and lots of people, there are reasons to stay on the retiree plan and reasons to come off.
Well, all good questions, and
yes,
Jo, thank you so much for your time. My takeaways are this: number one, mistakes are costly.
Right.
And number two, you need a trained professional to kind of help you wade through the minutia of Medicare. And I'll say it again, we've had a couple dozen clients use Jo's services and have not had any negative feedback. She's been a delight to work with, and she really knows her stuff, as you probably can tell from this 45-minute presentation she put together for us. But just as the mistakes are costly and we need a professional, clients on the call will be familiar with our vocabulary here, our Live Well plan. And Medicare plays a big part into that. For someone that is about to retire, what we want to do is create a plan for the rest of your life. And from a standpoint, we do take whether you're retiring before 65, after 65 into account, and how we do look at some of the healthcare costs that you will incur. But the old saying, look before you leap. We think that's really important when you are approaching retirement or even in your first few years of retirement. We offer this Live Well plan on a complimentary basis, and for clients, we update this periodically to make sure clients are on track in retirement. So love this quote from Benjamin Graham, who is one of the mentors to Warren Buffett, who we all know. The best way to measure your investing success is not whether you're beating the market, but whether you put in place a financial plan and behavioral discipline that are likely to get you to where you want to go. And so inside this plan, we create what we call our family index number. What rate of return do you need to be, quote, successful? And our goal in retirement is for you to take the least amount of risk possible to have you get from here to there. And you say, well, why take the least amount of risk? Stocks have been doing really well since 2009, and you would be correct in saying that. But when taking money out of a portfolio, when you're in the distribution phase, i.e. retirement, the drawdowns are a lot more significant. And so we're not necessarily trying to outperform some arbitrary stock market index. What we're trying to do is figure out what amount of risk does the client need, and then let's only take that amount of risk necessary for them to be successful. And, we're getting a lot of questions on how do investment process work. Most recently, there's been a lot of questions on inflation. Randy and I are putting together a good client email we'll be sending out, if not this week, early next week, on kind of inflation, our thoughts there. But I'd say, boiled down, everything we're doing is predicated on producing income. Income, we think really is the number one goal in retirement. The second goal is don't forget the first, because what that's doing is really reducing the amount of stress that you have on your investment portfolio to meet your needs, wants, desires in retirement. So for clients on the call, very good to see some names pop across the screen here. Updating the Live Well plan, we do that on a regular basis. If you would like us to create one for you, happy to do that as well. Comfort, confidence, and clarity, the 3 C's, we think that's what we're really going after with this Live Well plan, and tying everything together. So from the Price Group, I want to say thank you for coming. Any questions for us, let us know. Any questions for Jo, you can email me as well. Once again, my email on the screen there, and I can forward her that, and let us know if you need anything. But happy Thursday, and we'll look forward to catching up soon.